Dr. Elkowitz, and I'd like to discuss a patient of mine with you. This is a 68-year-old lady who presented to me with primarily unhappy with her neck, unhappy with the aging appearance of her face, and unhappy with the aging appearance of her forehead and her upper eyelids. You can see on her neck she has what we call platysmal bands, and in her it's interesting because they're really classic. A lot of times patients will come in and they're unhappy with the wrinkles in their cheeks, or marionette lines here, or deep nasolabial folds here, or excess skin hanging on their neck. She's a thin lady and she didn't have a lot of fat in her neck. She had classic platysmal bands, and what that is the neck muscles. There's two muscles, one that runs on the left and the right side of the face, and they're, when we're young, when we're kids, when we're 20 years old, they're generally connected in the midline. And as we get older, when everything kind of falls and settles, those muscles separate. And those two lines there are the medial margin, or the medial edge of that muscle that kind of hang down. And it's classic because as a plastic surgeon, that's one of the things we in the anatomy that we pay a lot of attention to. And her neck was just a walking atlas of anatomy, because you were able to see exactly what happens with aging. And I thought that was kind of neat with her, and a lot of times you don't see that perfectly obvious in all of our patients. The other interesting thing about her is that she definitely needed her eyebrows and her forehead lifted, and she needed her upper eyelids taken care of, the extra skin and the bulging fat pockets, but her lower lids were fine. Very often patients come in for their eyelid surgery, and they need both upper and lower eyelids because, let's face it, the upper eyelids are 68 years old and the lower eyelids are 68 years old. But hers were just fine, and we both agreed they just weren't worth dealing with and weren't worth operating on. If you don't need something done, there's no point in doing it. So we did her eyebrow lift, we did her upper eyelids, and then we did her face and neck lift. And you could see that the incisions and the scars are virtually invisible. Very small incisions around the ear, and then everything else goes behind the ear and into the scalp. The eyelid incisions just generally melt away, and the eyebrow lift is up in the hairline up here, and those are really very well hidden, and patients do very well with that. I think she had a great result, and more important than what I think, I know she's very, very happy. And in fact, we're going to show you a little bit of surgery, how that went for her in the operating room, and then we're going to go ahead and you guys will meet her, and she'll tell you exactly how she feels, and we are very, very proud of how she feels about that result.
I'm Shelley, your flight attendant. And probably about 2 years ago, I was really looking at changing how I felt about myself with a turkey neck, and a lot of, just droopiness coming in here, which comes with age. I was turning 69 in a year at that point, and I decided to really think seriously about getting a facelift and looking for the right plastic surgeon. So I did about a year's worth of research, and at that point I decided I definitely wanted to do it, but I wanted to make sure I had the best. So I went to my doctor, Dr. Roth, and he suggested Dr. Marc J.Elkowitz. And I still did my research. I came and met him and Holly and everyone was so helpful. They weren't pushing to me at all about getting it done. They took their time. They said, take your time to decide, and gave me all the pros and cons, which were mostly pros, I have to say. And so I decided to do it. And I still took another 6 months to think about it. And I came to visit Dr. Elkowitz and Ollie several times, and they, you know, took me through everything, what was going to happen post-surgery, and everything went just smoothly. I had no complications. It's been, let's see, in September it'll be a year. Right now it's July. And I'm making very good progress. I love everybody here. Everything they promised me was true, and my doctor was also very happy with the results because he sent me here in the first place. So I would definitely recommend the top doctor in plastic surgery in New York, Dr. Marc J.Elkowitz.